Hey everybody, welcome back to my channel. I want to go ahead and just get started on this so my video is not too long. As you can see in the background, my kitty, his name is Blanc, like Blanco, Spanish and white in Spanish. So I figured people would be asking. But today, like I said in my last video, we are going to be talking about endometriosis. Disclaimer once again before we get started, I am no doctor, I am no nurse. I have taken nursing classes, but I'm not a professional. This is based solely on my personal knowledge and my personal experience, sadly. So let's get started. Endometriosis is a disease that only females can have. It is specifically in the female respiratory. Did I really just say respiratory? That is the lungs and heart. Okay. It is specifically in the female reproductive system. There we go. In the female reproductive system. And what endometriosis is where the lining of the uterus that usually lines the inside of the uterus, every month when it sheds out, you know, it exits your body, and that's through your period. So what endometriosis is, this lining of the inside of your uterus, instead of shedding all the way out, you know, through your period each month on its own, it gets stuck along the way in a woman's body. And so what this causes is a lot of that endo tissue, which is, endo is the medical term for uterus. And so the endo tissue that's supposed to shed stays and gets stuck and like kind of sticks to anything in the reproductive system, whether it can affect the ovaries, the fallopian tubes, and I know I've heard of it affecting bowels, like your intestines, things like that. I know I've heard of cases where it can be found like in the cervix, things like that. So what endometriosis does, well, I just told you what it does, but how it affects the body is, it is super, super painful, because you have this endo tissue. Some people call it endo tissue or endometrium tissue or scar tissue. And so we're just going to use the term endo tissue or scar tissue. So if you hear me saying those, it is the same thing. So I want to kind of share my story with you about my endometriosis. I have a hair. Oh my gosh, this hair is stuck. Anyways, so my story with endometriosis, I want to start from the very beginning. I feel like I've had it a lot longer than what I've been diagnosed with it. I started my period when I was 11 years old, and I'm now almost 20. So when I started my period in the 5th grade, I had super heavy, strong periods. I mean, it was to the point where I would wear tampons and pads, and I would have so much blood go through those that it would still go all the way through my underwear, all over my legs, down the side of my legs, everything. And so that kind of raised eyebrows for my mom and I. And so, you know, we went to the doctor, and they were like, well, you just have heavy periods, you know, you just started. And so we were like, okay. But at this time I was also having quite a bit of intestinal problems. I'd have a bunch of diarrhea. I'd have quite a bit of like a nauseous feeling, things like that. So, you know, me and my mom just thought maybe it's just because my periods are super, super heavy, or, you know, maybe I'm just cramping really bad and that's what's causing it. So we just kind of push it off, as I was just cramping and my body was just kind of getting used to and getting the feel of being a woman for the first time. So as the years went on, around the age of 13, I started really having issues again. So about 2 years later, I started having really bad cramps, super, super bad, like back aches. It would get so bad to the point where it would actually make me puke. Like, the pain would be super bad. And of course, in this time of my life, I was going through a lot of depression, things like that. So you add this pain and depression, and it just does not mix. So, once again, my mom took me to the doctor, yada, yada, yada. They, said you just have IBS and super heavy periods. You might have some cysts in there. That's just normal. They'll go away on their own, stuff like that. And so we dealt with it and dealt with it and dealt with it. And so go forward to 2015. So 4 years later, I'm still dealing with this same stuff every month. And usually it's around the same time of my period. So we finally got me into a gynecologist and also a gastroenterologist. And so when I went to my gastroenterologist, he firstly did a colonoscopy on me to rule out anything colon-wise, stuff like that. And at that point in time, I had no ulcerative colitis, which in my last video, I had talked about that and how I have that as well. So if you want to go back and learn about that, you can do that and how I was diagnosed, blah, blah, blah. Anyway, so this was before my gastroenterologist found this, my colitis, or anything else. So we got the colonoscopy photos back. The diagnosis was nothing. I just had irritable bowel syndrome. So then go to the gynecologist. She asked me all these different questions. I tell her my symptoms, things like that. I was super scared to get like a pap smear or anything like that. So I was like, no, I don't want to do that yet. I'm only 15. So we did not do that, but she discovered that, or I guess she thought maybe I had PCOS, which is polycystic ovarian syndrome. And what that is you have super heavy periods, cysts on your ovaries. It causes a lot of hormone imbalances in the female's body. Sometimes women will grow extra body hair. Like sometimes, you'll get like chin hairs or excessive leg hair, armpit hair, things like that. A lot of just different signs and symptoms of that. So they diagnosed me with PCOS because they did some blood work stuff, found out, maybe that's what's going on with me. So, I got on some medicine for that, stuff like that. Went back to the gastroenterologist. A little later, finally was diagnosed with ulcerative colitis along with the PCOS. So at this point in time, we were like, hallelujah. Finally, I can get on some medication or do some physical therapy or anything to kind of help my pain and heavy periods. So they put me on birth control. Before 2015, I was on birth control in 2013, and I have been on it ever since, even to this day. Also, so anyways, let's move on. So I was, like I said, diagnosed with the ulcerative colitis and the PCOS. So they put me on birth control and just like a anti-spasmodic pill, which just helps ease your colon, stuff like that. So my periods throughout being on birth control regulated, because there were times where every single month through the age of 13 through 15 years old, I had my period all day, every day, throughout the whole entire month. Usually women will have their periods for, on average, 4 to 6, 7 days. I was having mine all month, every day. I only would get off of my period for about 4 days a month, and throughout the whole time I was losing a bunch of blood. I was anemic. Like I said, just super lot of pain. And so as I got older and I went through the age of 16 and 17 and 18, me and my mom learned about endometriosis, and we had kind of heard about this from my aunt who has it. She was like, well, it sounds a lot like you have, you know, endometriosis. And so me and my mom did a lot of research on it, and you know, a lot of my symptoms added up with it, so we were kind of like, well, maybe this is what it is. So anyways, fast forward to 2018. Up to this point, I'm on birth control. My periods are controlled. They are normal. Still super heavy though, but the days are normal. I have normal period days throughout the month. Excuse me. Things like that. Still having a lot of pain, but the pain that I started to experience around 2017 and 2018 last year started to be really sharp pains, what felt like up inside of my vagina and up all in my pubic area, and you know, all around in my legs right there. I would get it really bad cramps, but it started going from cramps to super sharp pains. Like it felt like there was barbed wire like inside of me is what it felt like. And so in June 2018 last year, I decided to go see my gynecologist again. Finally, I let them do a pap smear because I was like, you know, something's going on. It's really starting to hurt. I've started having a lot of pain with sex, you know, things like that. Even just wearing tampons, I was, you know, something is not right here. So I went to see my gynecologist. She did a ultrasound, a vaginal ultrasound, just so she could see everything clearly. So she found a super massive, what we thought at the time, cyst on my left ovary. So she comes back and she tells me, you know, we need to get this out of you tomorrow. So she schedules me for a laparoscopy surgery to remove this, once again, what we thought was a cyst off of my left ovary. It was so big that she told me that they might have to take my left ovary. And you know, I don't want kids. I don't have any desire to have kids. My fiance and I have talked about it. You know, whatever we need to do to keep me healthy, you know, we're gonna do. And so I was like, okay, that's fine. If you need to take it, take it. You know, maybe that will cause less problems for me. I can continue to take birth control, hormones if I need to, you know, stuff like that. So the next day comes and I'm going into surgery. They're doing a laparoscopy. You know, I wake up, they tell me, I wake up with I think I had 5 incisions on my belly. She tells me that I did not have a cyst on my left ovary, and I was kind of dumbfounded. I was like, well, we saw a huge mass on the ultrasound. So she tells me that she kind of looked around and to make sure, because she knows she saw something on the ultrasound because it was huge. So comes to find out, she found a big tumor on my up underneath my colon on my pelvic wall, along with an endometrioma, which is a cyst that has a lot of blood in it, that is formed by the endometrium tissue or scar tissue, endo tissue, stuff like that. And so she removed those, and you know, did the pathology. And after that, I felt super good. Even though I just had this huge thing removed, I felt really good. You know, the recovery, it wasn't too bad. I just had some shoulder pain from where they inflate your belly to see super clear. But that's about it. I felt super good for about a month or so. I had gone back to work. I was working as a home health aide. So when I went back to work, I started having even more pain than I was having. And so at this point in time, I asked my gynecologist if maybe I had the endometriosis, because I had just had an endometrioma removed. And so she said, well, we think that you have cystitis, which is like inflammation of the bladder. And I'm sitting here thinking, when she's telling me this, okay, that would make sense for when I feel like I have a UTI all the time, but that doesn't make sense for any of my other pain and what we found during surgery. So she diagnosed me. She did this test on my bladder. She put a catheter in, injected stuff to diagnose me with cystitis. She did diagnose me with that as well. You can just look that up. That doesn't affect me as much as my other diseases, so I probably won't do a video on that. If you want me to do a video on that, comment. But otherwise, I probably won't make one. But anyway, so she just diagnosed me with that, told me to watch my diet, and we went on. So this whole year up until now, the current time, I've had tremendous amount of back pain, super bad cramps, super bad stabbing pains in my vagina, up inside in my what feels like my ovaries, you know, my uterus, all just in that woman area down there. I just had so much pain, and I still have super amount of pain to this day. So finally, about like 2 to 3 months ago, I decided to see a new gynecologist. So I went to a new gynecologist, and I told her every single symptom I've been having. She sat down with me, went over everything, did a pap smear, everything came back normal on that. No cervical cancer, thank goodness. You know, stuff like that. Did a bunch of blood work. Everything with that was normal, except that my iron was low and I was a little bit anemic. And she said, well, have you heard of endometriosis? And I said yes. I said, I think I have it, but I'm not sure. You know, I'm not a doctor. And so I told her that, you know, what my last doctor said, she just diagnosed me with a cystitis, blah, 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 blah. And so my new gynecologist says, well, let me look up your past surgery and look at the pathology part of it, you know, which is what they diagnose you with, what kind of diseases you have, stuff like that. So she lets me wait in the area, in the waiting room. She comes back, and about 10 minutes later gets my records from my last surgery from my other gynecologist. And surely enough, right then and there, she takes one look at my laparoscopy photos and diagnoses me with endometriosis right there, before even looking inside of me, anything like that. I literally cried. I cried because I was happy that somebody finally heard me and listened to me about my symptoms, and finally looked closely at me and my history, and finally diagnosed me with what has been going on with me. So we talked about a lot, well, we didn't talk about a lot of treatment options, but we talked about doing another laparoscopy, which I totally agreed to. I wanted to see what she found, you know, since she clearly just diagnosed me. I felt like I could really trust her. She knows what she's doing. So we scheduled my laparoscopy, and I had it last Monday. It is Wednesday of the second week. So I had my surgery a week and a half ago. I'm still recovering. Today I woke up and I felt, you know, really energized. I felt a little better. I'm having some cramps, some back pain, but I wanted to go ahead and make this video because I have had time to heal. I wanted to put my healing process in here with my incisions and things like that. So anyways, so for my surgery last week, my doctor went in, my gynecologist went in, and looked around for endometriosis that she could remove, you know, anything she could remove, scar tissue, stuff like that for me, because you can remove it surgically, and that's what she was going to do. And most of the time, for a lot of women, that's the only option, is surgery, surgery, and surgery to even just treat endometriosis, whether it's to treat it or to remove some of the scar tissue. This is a non-curable disease. It's even, I've heard cases where even after you have a hysterectomy, you still have some endo tissue in there that has just stuck in there, things like that. My gynecologist went in, before my surgery, she thought I had a lot of endo tissue up in my colon, and like I said, endometriosis, when that tissue sheds out of the uterus, it acts as like a glue, kind of. This tissue acts kind of like a glue and will bind and stick your organs together. So for me, I have a lot of mine is growing on the outside of my uterus and in my bowels. She went in, she found that it was pretty clear for the most part from my last surgery, just because she thinks that the birth control has helped reduce some of that tissue, kind of cleared it out a little bit. But she did find some up in my colon. Of course, some have quite a bit that she can tell has been there or is forming there around my fallopian tubes and ovaries. And so what this does, in stage 4 of endometriosis, you tend to get a lot of endometriomas, like what I told you about earlier. You, like I said, it acts as a glue, and it, you know, if mine gets to a stage 4, it can make it to where my ovaries can stick to each other, or my fallopian tubes and can, you know, stick to my pelvic wall, which is what causes a lot of the pain and a lot of the bad periods, things like that. So right now what's going on is I have endo tissue kind of making my intestines kind of stick together a little bit, like, you know, they move freely, but now they're kind of like stuck together. So I go see my gastroenterologist December 2nd of this year, and we're going to see if he needs to do any surgery to remove any of that. I'm also getting another colonoscopy, woohoo, to check on my ulcerative colitis. So I wanted to share this with you guys. I have surgery pictures from my first endometrioma, and if I can figure out how to post pictures like in my video, I will. Because I really want to share the fullness of what endometriosis is, and since I've been dealing with it a lot recently, I have a lot of things I could share. But this is my surgery photos from last week. As you can see, this is my uterus, and then the fallopian tube, and then you can, those little white things are my ovaries. You can see, you know, stuff right there. You can't really see too much endo tissue in these photos, just because, like I said, she said it was mostly clear until she kind of got up in my colon and stuff like that. Since she diagnosed me with it, she wants me to be super careful. She said a lot of times when she sees cases like mine, it's the endo tissue is microscopic, so you can't see it with a naked eye. So that's where a lot of my pain stems from. So once again, a lot of endometriosis symptoms are heavy bleeding on your period, spotting, heavy bleeding after your period, a lot of back pain, a lot of abdomen pain, whether it's cramps, super bad cramps, or like sharp pains, stabbing pains. Like I said, it's been so bad before that it's made me nauseous and puke, but just because the pain is so bad. There's been times where I've been driving and I'll get, I guess, like an endometriosis flare-up, and I'll get these stabbing, sharp pains all in like my pubic area, like I guess in my fallopian tubes or something, or my ovaries. Endometriosis is attacking something, and it's been so bad that I've had to pull off the side of the road because it hurts so bad, and it just hits you. It like hits you like a train in your freaking stomach, and not your stomach, but your lower abdomen. I mean, it is the worst pain I've ever felt in my entire life, and it is so debilitating. It is so hard for me just to vacuum my house. You know, the simplest of tasks is super hard because I'm in so much pain all the time. This is not a light disease. This can be a very dangerous disease. It can cause infertility. Since I have PCOS and now this, my doctors do not think I'll be able to have kids. And before anybody goes in the comments and says, oh, well, you can do all the drugs and treatment to try to make kids if you ever want them. No, don't say that to me. Like I said, I don't want kids. So those are a lot of the symptoms of endometriosis. There can be some signs physically where I know a lot of women, we call it our endo belly, and it's where you look like you're pregnant or you look super bloated and your lower abdomen. For some reason, this disease makes you super bloated every now and then, and it doesn't have anything to do with what you eat, drink. It's just, I don't know what goes on. So a lot of women deal with bloating, things like that, and you know, it's also been bad enough to where I felt cramps in my thighs, my outer thighs, inner thighs, stuff like that, down my legs. Like I said, it's just really debilitating. It's really painful, you know, just thinking about it right now. It's just so horrible. And I just really want to get awareness out there because, like I said at the beginning of this video, I feel like a lot of doctors are misdiagnosing it. I feel like a lot of doctors don't believe their patients, you know, illnesses, you know, stuff like that. I just feel like there's so many women out there that are struggling with this disease but aren't getting the proper care for it, or, you know, also endometriosis, the treatments that I know of personally from my new gynecologist, there is a pill called Oralisa, and then there is a shot called the Depot-Lupron. For me personally, I do not want to take these. The pill is the pill version of the shot Depot-Lupron. I've heard Depot-Lupron is a form of chemo that they used on men for prostate cancer. I've heard it causes a lot of bone density, bone loss, you know. I've heard it causes super bad mood swings, depression, suicidal thoughts. I'm already depressed, I don't need that. I've just heard it causes a lot of stuff, but once again, that's just what I've heard, that's what I've researched. You know, I don't want to discourage anybody. You know, it might work for you, it might not. I'm just scared to try it because I already have so many issues. I just don't want to deal with that. Of course, you can also take birth control. My birth control is, you know, it's regular birth control. It's just, my birth control has a higher dosage of estrogen in it, which is the female body's hormone. And my gynecologist thinks that's what's kind of keeping my endometriosis at a low at this point in time. She thinks that if I ever stopped it or got off of it, that my endo would worsen super badly. We have talked about a hysterectomy for me. Like I said, I'm 19, almost 20. I've talked about it, thought about it, and if it comes down to needing a hysterectomy, I'm fine with it. Over this pain, I'm just over it. It is literally an everyday battle. There's days I can't even get comfortable in bed, and, you know, it's just, women who have it, you know, gosh, you just don't know unless you have it. I mean, it's just so horrible, and that's why I wanted to shed a light on it. So that's my story. If I can, I will put photos in my video. I'm not sure what I'll be making my next video on. I might just do something fun, you know, like how I do my makeup, or, you know, today I wanted to do like a sunset look, so we kind of did that. You have my kitty in the background, but anyways, so I just wanted to go ahead and get on here, tell people what endometriosis is, my story with it, and some of the treatments, symptoms, blah blah blah. So I hope everybody enjoyed this video. I know it's a half an hour long. I really hope that if you made it this far that you have enjoyed it and that maybe you learned something new. If anybody would like to ask me any questions, you can DM me or on Instagram, or you can comment below. I will get back to you as soon as I can. If you have any more questions, just let me know. And I think that's it. I think I will shut up now. So, thank you everybody so much for listening to my story with endometriosis and, you know, things like that. And I just really appreciate it. And as you can see, Blanc's back there taking a nap, so he's just chilling. But thanks everybody so much for listening. Make sure to like and subscribe, please. I'm really trying to build this up. Hope everybody has a good day.